The Kerugoya Referral Hospital in Kirinyaga County itself is ailing. A total mess. No running water, blocked toilets, piles and piles of unwashed linen. A broken down incinerator shows just how dire the situation is. It has become a serious health risk to not only the patients, but also the health workers. Of 200 casual workers on 24th April, the Union of Clinical Officers now threatening to withdraw their services to avert exposing their members to danger.
There are several nurses who are experiencing diarrhea. Others nurses last week were the two of them. They were diagnosed with hepatitis B. And also other infections. We are fearing cholera. There is cholera outbreak in Embu. So we also feel it can be transferred to this place.
Mimi nimekuja kuangalia mgonjwa wangu, amepatiwa mtoto wiki mbili zilizopita, alikuwa amelazwa kule nasari, na sasa vile nimeendelea hapa, hiyo hospitali iko na uchafu sana, so ni tatu na watu ni wengi. Mambavu ni mawili na watu ni wengi sana. Tunahitaji gavana wetu yani Waiguru akunje arundisha wale wafanyikazi wa kuosa huku na kuangalia huku.
Patients are greatly affected. A patient with drug-resistant tuberculosis is in the same ward with newborn children at the maternity wing. This is after she was admitted to give birth a week ago, exposing over 100 newborn children to the deadly disease.
Ni shida ni uchafu ndo mingi. So tunaomba kama inawezekana wafanyikazi wenye walikuwa waweze kurudi. Watusaidie. Hata wakati tulifika hatukupata bed sheets zikiwa safi, tulikuwa tunatumia zetu.
Nimeenda nyumbani bila kupona. Sababu ile uchafu iko hapa ni nyingi sana. Hata huku ndani ukienda uangalie hivi, inzi ni kama sinjui ni kama nini. Sasa nikaomba ruhusa nenda nyumbani, kama nikukufa nikufie huko nyumbani ama niende vile nitaenda. Sababu hapa ni mahali mbaya. Mimi sioni anja ya serikali ya county. Serikali ya county ni ya nini? Hakuna serikali ya Uhuru isukue mamlaka ya county isukue. Kama ni madaktari waandiko ni serikali kama samani.
According to Mwangi, many cases of hepatitis B continue to be reported in the hospital. More nurses and clinical officers testing positive of the disease. The situation at the hospital is that health workers have issued a 72-hour ultimatum to the county government to rectify the situation immediately, failure to which they will down their tools, paralyzing services in the hospital. The catastrophic state of the hospital is blamed on negligence and lack of adequate funding. Dorcas Wangira, Citizen TV.
All right, so you look at those very disturbing images of the Kerugoya County Referral Hospital, and just before I pose the question, Governor Isaac Ruto, what would lead to such a situation in your thinking?
This, in my view, is absolute carelessness on the part of the governor herself and the entire administration. I don't think this is information she cannot get on a daily basis. There must be a system of gathering information as to what's happening in all parts of your county. In the morning, in fact, not even before lunchtime. In the morning, before you go for breakfast, you ought to know what is happening.
Right.
And I just can't understand how a hospital can look like that. That is definitely not a hospital. The mistakes the new governors seem to have made is that they dismissed a number of employees on the pretext that they were employed by the other governors. And some of them, there is a lot of petty thinking at the lower levels. And it's a mistake that even the Public Service Commission has not declared the county service as a public service for the purposes of security of tenure for the jobs, for the employees at that level. So there is that problem. So there is no connection and continuous performance of duty without fear. So you'll find employees becoming extremely scared of working.
But how is that? Yet the hiring body is the County Public Service Board.
The public service boards have not worked up to the standard. They have not even, their procedures tend to deliver employees rather too late. And if you find, probably they are still advertising, while Kerugoya Hospital is in such a mess.
All right.
It should be possible for the governor to quickly even get employees even on contract to deal with this situation.
Right.
But this is completely unacceptable. You cannot leave a hospital to reach such a stage and you pretend that you are still doing something about it.
And the update we have is that the county governor, Anne Waiguru, has set up a task force to oversee the immediate cleanup of the hospital following the story aired by Citizen TV on Saturday. And the task force will look into the mess at the hospital by Wednesday this week and prepare a report within 14 days.
No, it's not a question of a report. It's a question of cleaning the hospital. A report so that she thinks about how to clean the hospital. She should go there and supervise the cleaning of the hospital. County governments are devolved. The county governments are not meant to be abstract administration at the lower level. They are supposed to be practical and with the people. It is the people's county. It is the people's government where they can walk to the office and get solutions. But the real question is, how did Kerugoya deteriorate to that extent?
Senator Lekina, you hear one of the speakers there saying that he sees no need for a government and that function of health should actually revert to the national government. And there has been this large conversation about, did we devolve the health function early? Should we revert it back to the national government, especially to do with the manpower? So the Kenyan there is still waiting for services, but where do they go?
First of all, let me express my disappointment with Governor Waiguru, because I remember during the devolution conference when we were there was a phrase that she continually used, that Kirinyaga is rising. In this case, actually, Kirinyaga is not rising, but it's actually falling down to the dogs. And I would expect the governor, the first thing she ought to do is to let go a CC in charge of health. Because the reason why you elect or you appoint somebody to assist you is to be able to do what Governor Isaac Ruto is saying, inform you on the state of the hospitals. What the gentleman was saying is something that most of us really been questioning, because you know, and this is the reason why, and Kenyans ought to know, this is the reason why we in the Senate removed the 9 billion shillings which had been allocated to the MESS program. Because with the national government, you know, spending about 9 billion shillings or more to be able to, you know, support these health facilities. In fact, I congratulate my friend here, Isaac, because he refused to sign that national project. So it's not a question of whether these things should be taken away from the county government. It is, or given to the national government. Because even if it's given to the national government, the entire activity will still be in clouds. I think what we ought to ask ourselves is this: what do we need to do to ensure that we improve our healthcare facilities? Right. When you look at the Jubilee Manifesto, or rather the Big Four agenda, health is one of the issues. And this is why some of us keep on saying that this government will not achieve any of its agenda, the Big Four agenda. Because if the health of its own citizen is not serious enough for them to be able to take action, then how are we going to be able to build the 500,000 houses? So I think there's really no point of saying you're setting up a task force. What Anne Waiguru should do is to take her entire government to Kerugoya Hospital and they start fixing the mess there.
There's one question I would like to pose to Waiguru.
Okay.
How much money does she allocate to Kerugoya Hospital as a recurrent cost every month? Are there funds for that? Is the administrator there having a fund to clean up the hospital? That hospital must have a minimum of 6 million every month for little things, for running of that hospital. And does she allocate funds to that hospital? That's where she should start. It's not a task force. The question is, does she allocate the funds to clean up the hospital? All right,
and Senator Kangata, to bring you into this, because part of the reason that we have the situation at the Kerugoya County Referral Hospital is because there are some workers that were laid off, apparently because the wage bill was ballooning. So how do you make sure that there's prudent utilization of resources, but you do not hamper service delivery for such a key facility in a county?
For me, the role of contractual employees in a county hospital or even any other system cannot be gainsaid. They are usually very key. The reason being that, of course, you don't want to employ people permanently, because that then comes with issues to do with pension, issues with, to do with about unions which will demand huge payments of money. But on the other hand, they do a very good job. And therefore, to that extent, I think her decision to fire those employees was ill-advised. I see them, for instance, in Murang'a Hospital, and for me, they do a very good job. And therefore, most likely, she ought not to have fired those employees.
Right.
It made sense for them to be in that place in the first place. The issue about ballooning wage bill is an issue of governors failing to look for more resources. There are several potential resources out there. Probably she needs to see so that to ensure the money she gets can be able to sustain that workforce. One, you find most counties have huge portfolios of debts in their land rates. Some have not even updated what we call the valuation rolls, and therefore that's an area where they can leverage and get more money. You find them also, the advertisement levies that they charge advertisement entities is quite low, and therefore there are many areas they can be able to get money and pay off their workers. Of course, I'm not saying that they should have bloated workforce. No, it doesn't make sense. Remember, under the law, minimum 30% of all resources must be devoted to development, and you find most counties are breaching that law. You find almost some of them doing 90 or 80%. They are all just paying what we call recurrent expenditure. But on the other hand, we must appreciate the role of workers in ensuring service delivery, particularly in the health sector.
And so, Antonio Loch, as you look at this, of course, the National Assembly is primarily mandated to share the resources to all these functions. So, how do you ensure that you do not end up with such situations because of deficiency of resources?
I'm not so sure that the issue here is about resources that have not been allocated, because all counties, I think, share the equal share of the revenue that is given. If this was the situation, I think we should be having the same hue and cry in Bomet as you had it in Turkana. I think this is a question of pure negligence, and I think other than just firing the CEC, I think we should be even more radical. There are situations where the Constitution has contemplated winding up or taking over a county. And I think this deplorable state of the situation in Kerugoya, I think is one in which the government ought to seriously consider whether or not we should not take over that function for Kerugoya. If not, suspend Kerugoya or Kirinyaga county as any. Secondly,
but that's a long and winding process.
It is, but health is as big as you can go in terms of one of the health functions of county government. If we have mismanaged health and a referral hospital to this extent, I think that calls for a serious, it's an emergency. Number two, this is a referral hospital, and if I'm wrong, referral hospital, other than the money that we allocate, because you've asked, do we give enough resources? I think level 5 hospital, if you get to the level of level 5, additional funds are given to level 5 hospitals by the national government outside of the amount that we allocate to county governments for purposes of that function. So I think there is no excuse. I think the governor ought to take responsibility. The issue of the task force simply will not wash. I think the buck stops at the feet of the governor. Lastly, somebody has spoken here, I think the senator, about how we glorified at the conference the issues about this county government and how much they're rising. And Kerugoya and let me say Kirinyaga and Makueni, I don't know how we do these rankings. We've been given the impression that these are the shining examples of how county government is working. Who does this analysis? How did we not go through all these kind of things and be able to find out that this is really just things they give us in terms of statistics?
Or are they just first among equals?
I think there is a problem with all these ranking problems.
I think, allow me to say that the question of the wage bill does not sell. 35% of the allocations to the counties are enough to run an efficient public service within any county. It is possible, and they will still be able to run recurrent costs at another 15%. It's possible to allocate up to 50% of the allocation of the counties for development purposes. We did that in Bomet. It is possible, it is doable. And you cannot say that you are reducing the wage bill by removing medical staff. In other words, you are saying it's better half the population are dead so that your wage bill is low. That doesn't sell at all.
Service delivery has to take priority.
Service delivery is the most important thing.
Okay.
And you are not going to say, the people you should reduce are the ones who are around you. The ones who do not actually do a life and death assignments. But for medical staff, there is no such reason. And that's why I've always maintained throughout, and there were no strikes in Bomet in the medical department. I believe there should be no argument between governments and the medical staff over their remuneration.
Right.
These are people who don't run matatus after 5. After 5, they are still in their houses ready to help you out. After 5, the rest of us go to bars, we beat up ourselves with bottles, and then we rush to hospitals for the medical staff to save our lives. And then we come back and we start arguing about should we give them a pay rise or shouldn't we give them a pay rise.
Right.
It's a very ridiculous argument.
No, I think I agree. I think we have just confused the whole healthcare sector, because if we don't care about the affairs of the employees, then what are we saying? We're saying we don't care about our own health.
Yes.
Some of us are very lucky that we can be able to afford insurance.
Yes.
But we really ought to think about, and we can go to other hospitals, but we need to think about the hospitals in the county governments. We need to think about the hospital like the Kenyatta National Hospital. We need to think about national hospitals, level 5 hospital, level 4 hospitals. And what I find to be a little bit confusing is that these county governments actually do collect on-source revenue.
Right.
And some of that money comes in from these hospitals. Why don't we realign our existing resources and try to live within our means, instead of us saying, national government, come up with a MESS program, spend billions of shillings in leasing equipment,
which is now unwanted.
And then county government themselves are going out and buying those equipment. Why buy equipment? Let them rot there. Why don't you just fix basic medical services? In fact, and I'm sure the Senate Committee on Health, which is chaired by Mpito, will be heading to Kerugoya to be able to look at this. But I think we shouldn't really be having to resort back to the oversight body to come and check something after the effect. I think we have to come up with a system where we know what is happening in all our healthcare industries. We know what hospitals are there. And the Ministry of Education, one thing, Ministry of Health, one thing which is very, very funny is that a lot of money remains in the Ministry of Health. And very little money is sent to the county government in terms of, hospitals. So what we need to do is now to figure out how much money do we need to be left in the national government in terms of the Ministry of Health, and how much of that money should actually be sent to the county government
on the ground. Cedric Marenya on Twitter says that we need to only improve the conditions for now. We make do with what we have, talking about resources that we have are sufficient for whatever needs that we need, services we need to finance. We have some text messages coming through. Let's take a look at that feedback on the screen, what you've been saying on 22422. If we have them, we can take a look at them. First of all, we have Nixon Ndugire from Kindaruma says that the Kirinyaga Hospital mess could also be sabotaged by angry workers in solidarity with the sacked casuals who used to clean up. I don't know whether that's true, but it's a possibility. Jumbo, Daybreak team and panel. Mangororo School is a classical example of effects of corruption. Even if it's a national government function, the government could provide leadership on other ways out. That's consistent with what Governor Ruto was saying. Then finally, Eric from Ngomongo, Kiambu County. Talking too much won't solve the problem. We need action. Quite putting it rightly. So we want to take another break, but when we return, we'll be talking about the politics of the weekend on the meeting that Raila Odinga had with leaders from the Gema communities, as well as whether there is need for a referendum push. There is division on that. But as we do that, there's a clip that went viral on the internet a few weeks ago on the functions of between the government and the national government and how the Mwananchi is left in the middle. So we take a look at that, but we'll be back shortly.
Tuna promise nyinyi wananchi, nyinyi wananchi mtapata vitu zenu, ndio hii serikali inatengeneza. Nyinyi wananchi 2022 kila kitu itakuwa sawa. Mta serikali ya county inasema ni national. Mmenyang'anywa bana. Ngoja bana. Ile serikali ya kutiswa. Mambo ya revolution. Tunakula pamoja. Unaona gani? Hamna bana. Pesa kwa kidogo. Ndio hiyo. Enda county. Enda national. Enda county. Enda national. Kuna maneno. Enda county. Enda national. Hiyo iko devolved ama? Hii mambo devolved government. Enda ile before agenda. Hii vitu imedevolviwa.